Thank you and welcome. I'm Mary Vize. I'm a certified public accountant with over 18 years of experience in clinical research. I've actually created a clinical research finance department at a large academic medical center, and that over the last 18 years, and it's been very fun and rewarding to do that. And so this is why I'm actually doing these training sessions to help share my knowledge those who really want to learn and understand this process. I do have an extensive auditing and financial background that I garnered prior to coming to academia, and I've leveraged that throughout my career path. I have a certification in healthcare compliance as well as research healthcare compliance. So one of the things we're going to talk through today, of course, is making sure we understand the learning objectives. So understanding fair market value is one of the big ones, and we'll walk through that in a few minutes. Reviewing key questions and terms to address how to develop those budgets, and then other tools and techniques to use that your sponsor site that you can actually help to develop those budgets, but also considering the sites and those different levels that they have to consider as well when you're creating the budgets from a sponsor's perspective. Some of the handouts we have today, and you should already have them, the recruitment tool planning template, feasibility assessment tool, and there's actually a feasibility assessment tool template, and then we're going to take a look at some sample budgets along the way. So let's start off by discussing what is fair market value and how is it assessed. So here's part of the things that I like to kind of get your feedback in the interactive session. So let's take a moment to share what you know about fair market value. So either Anna or Shanta, if you or some of your people that are attending with you want to talk about fair market value and what you've experienced, what do you know about fair market value?
Hi, Mary.
Hi.
So fair market value, we know that's something that's used to really assess the costs that are to be provided to an institution in terms of them conducting research. You know, there's platforms to use different cost measures to be able to assess that information.
Right. And Anna, do you have any perspective around that?
I have definitely heard the term, and I know others here have more experience with it. I don't personally have a lot of experience. I don't know if anybody else in the room.
For fair market value, yes, absolutely. And I think we've used that quite a bit when we're negotiating line items in a particular budget.
Right, yes, and it does impact the budget development process, and also sometimes it stalemates negotiations. So let's talk a little bit through that and maybe why those things are happening. Let's start by defining what fair market value is. So there's various, as you can see, various definitions for a fair market value. So oftentimes it's a price that a buyer or seller may be the reasonable knowledge of pertinent facts. Something that, so basically it's a price by which the buyer or seller with the reasonable knowledge of pertinent facts and not acting under any compulsion or willingness to do business. So basically it's just somebody's price. The buyer and the seller oftentimes have different fair market value prices. The Internal Revenue Service, on the other hand, says that the price of a service between a willing buyer and a willing seller, neither being under a compulsion to buy or sell, having both reasonable knowledge of the relevant facts about what they're actually putting that value and assessing that value. And then pharmaceutical commerce represents fair market value as a legal term that tries to define the appropriateness of payments when they are conflicting or at least multiple justifications for those payments. And I think that that's where you guys as sponsors would actually fall into that bucket of trying to figure out what is the justification for these dollars that these sites are trying to assess within their budgets. And then from an enforcement perspective, fair market value is basically legitimate. Is it legitimate? Are these dollars that someone is quoting for the value of this item or service, is that a legitimate fee to be charging for those particular items or services? Does this make sense to everyone?
Yes.
Great. So let's continue a little bit more in talking about how fair market value and clinical research payments basically compare or intersect, and how provide a little bit of feedback from an academia standpoint about fair market value in a few minutes as well. So from a payment perspective for clinical research, it must be reasonable and meet the industry standards. That is, the patient care, maybe some patient care items or services. So that's usually where a lot of the budget development items are around fair market value is, what is a reasonable value for that item or service? And is that same item dollar amount that you're quoting a sponsor or quoting a site, is that the same value that you would send out to a third-party carrier like an insurance company? It's usually each line item or service is reasonable based on the area and the geographic location. So you have to take geographic location into this because certain areas will have higher cost simply by the region of this country that they are living in. Then when it comes to some of the expertise of physicians and how do you justify the payments associated with some of the expertise from some of those physicians, you look at maybe a tier system, or is there the key opinion leader? Maybe they rank very, very high and they're world-renowned leaders, so their fees will be a little bit higher than maybe some of the other physicians who are just entering to the marketplace